Hi, I'm Dr. William Starsiak, and in this video, I'm going to describe another service provided at the Starsiak Osteopathic Clinic called Prolotherapy. Prolotherapy is used to strengthen lax ligaments and/or joint capsules. It involves using a needle to inject an inflammatory substance into the joint capsule or into the region where ligaments attach to bone. And it's employing this principle that the body uses to help re-strengthen ligaments and joint capsules and fascia that have been worn down by use or injury. Use or injury will create inflammation that is equal to the degree of damage done to that tissue. That inflammation will attract these cells called fibroblasts to the area of use or injury. Fibroblasts are like little spiders crawling around in the connective tissue of the body. There are these cells that lay down new collagen to re-strengthen areas of injury. Now, prolotherapy creates that inflammation in a very localized region to recruit a bunch of these fibroblasts and get them to strengthen that region of connective tissue, whether it's a ligament or a joint capsule. It can be done with different substances. Sugar water, dextrose, is a very common one, and sometimes that's combined with sodium moreuate or vitamin B12. A less common one is finely ground pumice dissolved into solution. Two very common ones are whole blood and plasma. The trend right now, more people are using plasma, even though all of the research which I have seen show whole blood and plasma to be equal. There are some theoretical benefits of plasma, but that hasn't played out in the studies. The studies haven't shown any superior results from plasma. So really, it just adds another step, and it adds a reason to be in the office for longer. So what I've been mostly using with success is whole blood. So we draw the blood out from the patient's arm and then put the correct needle on for the region that's going to be injected. And then simply, if it's a ligament, we meet the ligament where it attaches to bone with the needle and inject a little bit of the whole blood there. And then on the other end of the ligament, we'll do it there. This can be done very successfully for knee osteoarthritis. That's one of the things that has been heavily studied. Temporomandibular joint dysfunction and pain also responds very well to these injections. Shoulder instability, back pain, ankle ligament instability, all of these are excellent cases to use prolotherapy. You may need up to 3 treatments. These treatments are spaced a month apart. In some extreme cases, you may need more for one region, but typically not. And it is a little bit painful because there is a needle going into the body and it has to touch the bone for the ligamentous injections. The intracapsular injections are actually a little bit less painful because they don't have to touch bone. But this pain is tolerable. By no means is it terrible, terrible, terrible pain. And it will be sore for a few days afterwards. But the results are so excellent that people find that it's worth it and will actually last. These results will typically last for 2 to 3 years before it has to be repeated. So all in all, it's a very safe, effective technique that is not all that expensive. If we're doing a single region, it will cost $150. If we need to do multiple regions, then there is some additional cost, just depending on how much we are injecting. So if you think that you have a condition that lends itself to prolotherapy, or you're interested in asking me some questions, you can give me a call at my office, 317-410-9978. You can email me at info@drstarsIak.com. You can also check out my website. If you go to the services page on my website, you'll see a section on prolotherapy that has a link to a large PDF document with all sorts of studies looking at all of the individual regions of the body that prolotherapy can be used on. And that's www.drstarsIak.com. Please subscribe to my channel. There should be a little link right here. And check out one of my other videos. There should be a little link right here. Thank you very much and have a good day.